Okay, so I'm Rick Ruiz Thomas. This is the case study assignment for the for medical terminology class. So I'm going to start. Just a note: the person I'm portraying is obviously going to be someone different with a different name. I just wanted to have a little fun. So the first section is my role and responsibilities. So I'm Dr. Mike Pierce, of which is a neurologist at St. Adelia General Hospital, which specializes in cognitive deficits, mental illness, and neurological treatments. As neurosurgeons, we treat symptoms, disease, and disorders that affect the patient's brain and spinal cord. We use a variety of processes and tests to diagnose illness, to form plans to remove the cause and prevent reoccurrences. My work setting is similar to many other doctors, meaning the patient is on the table, prepped and ready for surgery. The appropriate sterilized surgical instruments and tools are present, and other health officials are present to aid in the process of surgery, like anesthesiologists. So, analysis and treatment, which is the next section of the case study here. As neurologists, we noticed an increase in acute cerebralitis in children by 20% over the last 5 years in North America. As you are all aware, cerebralitis is inflammation of the cerebrum, which symptoms are present as loss of motor coordination, loss of equilibrium, severe headache, tremors, and dysarthria. A common treatment I use is a standard dexamethasone treatment plan for mild cases of cerebellar swelling. Due to the nature of the disorder at hand, the treatment does not take long, as it revolves around taking medication, where effects could be seen in as little as a week. So the next section is about the patient. So case discussion, patient information. So the patient is a 10-year-old adolescent girl. Her ethnicity is Chinese. She weighs approximately 33.4 kilograms, and her height is 138.5 centimeters. Her economic status is lower middle class. The symptoms that are shown for her is loss of motor coordination, issues with remaining balance, diagnosed with frequent migraine attacks. So, due to frequent headaches, dysarthria, ataxia, a magnetic resonance imaging was performed, which showed an inflamed cerebellum and hydrocephalus. Thus, the patient was diagnosed with acute cerebralitis. The patient was treated with dexamethasone and discharged to an associated physical therapy center. That way, she can regain, motor control due, to the ataxia. So she has better coordination, all that. So, the last section here is treatment and treatment promotion. So, to summarize, acute cerebralitis is a disorder that symptoms are presented mainly as headaches, nausea/vomiting, and ataxia. To diagnose cerebralitis, imaging of the brain is required, and other examinations may be necessary depending on if there are other local disorders. The treatment depends on the widely diverse conditions, and treatment with steroids is recommended in the case of cerebellar hydrocephalus. A possible major problem could be brain herniation, where such cases neurosurgical intervention will be necessary to prevent further damage. That's it. Hope you enjoyed it.